Hello, Namaste. I'm Dr. Amit. So, in the last two videos, we talked about autonomic receptors and acetylcholine receptor. Now, today we'll move forward and we'll talk about tissue distribution of adrenergic receptors, and we'll talk in details about alpha 1 and alpha 2 receptors. So let's start our videos. Today we'll talk about tissue distribution of adrenergic receptors. Okay, so we all know that adrenergic receptors is basically from sympathetic nervous system. Okay, so adrenergic receptors are activated by norepinephrine and epinephrine. So in our very first lectures, we talked about the sympathetic nervous system, in which there is preganglionic and postganglionic neurons. Okay, and these postganglionic neurons release norepinephrine, and they act on alpha 1 and alpha 2 or beta 1, beta 2, beta 3 receptors. Okay, so today we'll talk about these receptors. Okay, and today in this video we'll talk in details about alpha 1 and alpha 2 receptors. So the first thing is, in general, if we'll talk about adrenergic receptors, all adrenergic receptors are G protein coupled receptors. So this is very simple, as we have also talked yesterday, that G protein coupled receptors are nothing. These receptors have a G protein. So first the G protein get activated, and when the G protein get activated, then they releases second messenger, and those second messenger produces effect in those receptors. Now we'll talk in detail about alpha 1 receptors. Okay, so when norepinephrine or epinephrine is released, okay, so like in from this picture, okay, when norepinephrine or epinephrine release, then they will bind to alpha 1 receptors. Okay, so over here also same thing, norepinephrine, epinephrine bind to alpha 1 receptor. So as we all know that alpha 1 receptors are G protein coupled receptor, then GQ protein get activate, and they produces second messenger, and those second messenger can be IP3 or DAG, and that will produce effect that it increases intracellular calcium, and whenever there is increased intracellular calcium in any cell, then it will cause contractions, so it will cause the smooth muscle contraction. Okay, now let's understand clinically actually how alpha 1 receptor works. Okay, so in blood vessel there is vascular smooth muscles. Okay, so suppose this is our blood vessels. Okay, in blood vessel there is endothelium, and in the blood vessel there is also smooth muscles. So these smooth muscles contain alpha 1 receptors. Okay, so when the alpha 1 receptor of these blood vessels stimulate, okay, then it will cause smooth muscle contractions, and there will be vasoconstrictions of blood vessels, and it will increase the BP. So how it is helpful clinically? So there is a drug name called phenylephrine, which is alpha 1 agonist. So whenever there is any patient with hypotension, so when we give phenylephrine, then this phenylephrine will work on the alpha 1 receptor of these blood vessels, and it will helps to increase the BP of the patient. In the same thing, during cold or allergy, okay, there will be congestions of the nose of a patient. Okay, so because of vasodilations of the blood vessels of the nose, so what happen when we give nasal decongestions, those nasal decongestions also work on the blood vessels of the nose. Okay, and that will cause constrictions of those blood vessels and produces decongestion effect. In the same way, in the eyes, okay, in the eyes, dilating the pupil for eye examinations, whenever we want to do eye examination of a patient, then we give this alpha 1 agonist drug phenylephrine. Okay, actually we from this figure we can understand that there are two muscles in the eye. One is called this inner one. Okay, this inner one is circular muscles. Okay, and this outer one is radial dilator muscles. So this outer muscles produces dilating effect. So these muscles contain alpha 1 receptors. So when alpha 1 receptors of these muscles contract, then it will produce mydriasis. Okay, so also when if phenylephrine is put in the eye, it will produce dilating effect of the eye for examination. Now we'll see the alpha 1 receptor effect on intestinal sphincter. Okay, so we all know, suppose this is a esophagus. Okay, so and suppose this is a stomach. Okay, so there are two, over here also there is sphincter, over here there is also a sphincter. So on the GI sphincter, there is also alpha 1 receptor. Okay, so when norepinephrine bind to this sphincter, then the sphincter gets contract and the food will not passes. Okay, so it will help during stress, because during stress we don't need digestion of the food. Okay, so during fight or flight conditions, when there will be release of norepinephrine, it will contract the GI sphincter, and it will not it will help that food will not pass down during the stress conditions. Now let's see how alpha 1 receptor work on urinary bladder. Okay, so suppose this is our urinary bladder. Okay, and here is prostate. Okay, and there is sphincters in the bladder. So what happened in the internal urinary sphincter, urethral sphincter, there is alpha 1 receptor. So it contract the sphincter. Okay, and urine retain during the stress. So whenever there is stressful conditions, so it is not important to pass urine. So during that conditions, what happen, the norepinephrine will act on alpha 1 receptor and will cause sphincter contraction, so that the urine will retain in the bladder. Okay, so we can also use alpha 1 drugs. Okay, alpha 1 blocker drug in BPH. Why? Because suppose there is in BPH, what happen, the prostate get hypertrophy. Okay, and that will cause what, obstructions over here, so the urine will not come here. So if we'll block the alpha 1 receptor over here, then there will be no one to block the passage of this passage. Okay, so in BPH, alpha 1 near the bladder, neck or prostate, okay, over here causes urinary difficulty. So in BPH, if we'll give alpha 1 blocker like tamsulosin or alfusilin, then it will helps to remove the urine, because it will clear this passage. Okay, so this is how alpha 1 receptor works on blood vessels, intestinal sphincter or urinary bladder. Now we'll talk about alpha 2 receptors. Okay, so when norepinephrine will release, then what happened to alpha 2 receptors? So when norepinephrine release from that postganglionic neuron, then it will bind to alpha 2 receptors. So then same thing, it is also G protein coupled. So G protein activated, then a secondary messenger will release, then that will inhibit the adenyl cyclase. Okay, and because of that, there will be decreased camp in the cell. So whenever there is decreased camp in the cell activity will decrease. So basically alpha 2 receptor is also called as a stop receptor or a break receptor. It will simply release less product. Whatever the product released from that organ, that will be less. So it's basically switch off that organ. So let's first see how this alpha 2 receptor work on presynaptic nerve terminal. Okay, so suppose this is a sympathetic nerve. Okay, so we all know this is a presynaptic and there is a postsynaptic nerve terminals. So from the presynaptic this nerve, norepinephrine get released. Okay, so when this norepinephrine get released, it will work on the postsynaptic membrane on the different receptors, and this norepinephrine also produces of negative feedback on the alpha 2 receptors. Okay, so it's written here that sympathetic nerve releases norepinephrine, same thing. Okay, and when norepinephrine come back and bind to alpha 2, so this norepinephrine, whatever released from presynaptic nerve, that will go and bind to these alpha 2 receptors. Okay, and this will produce negative feedback. What happen, this alpha 2 will say this norepinephrine, please do not release now. Okay, so this is how this norepinephrine will produce negative feedback in the presynaptic nerve terminal. So let's see how this is clinically important. Okay, suppose in case of pregnancy or in normal condition, if the BP of a person is increases, okay, so we give a drug called clonidine or methyl dopa. Okay, it's a alpha 2 agonist. Okay, so when we give clonidine or methyl dopa, so it will come here and it will say the alpha 2 receptors that please don't release norepinephrine, so that the BP will decrease. Okay, so same thing, they stimulate the alpha 2 receptor, less norepinephrine will release and less sympathetic activity, and the BP will decrease in case of pregnancy or in normal case also. Now we'll see how this alpha 2 receptor works in the brain. Okay, so alpha 2 receptor also present in the brain stem. So we all know that these alpha 2 receptors are what, break receptor or stop receptor. Okay, so when these receptors are activated in brain, they will decrease sympathetic outflow from our brain, so that our heart rate or BP will decrease. Same thing, if we'll give clonidine to any persons, like suppose if any person patient has hypertension, or if any children is having ADHD, okay, attention deficit hyperactivity disorder, or if any patient has opioid withdrawal, or for sedation in ICU, we can use clonidine, because it will decrease the sympathetic effect and it will decrease the heart rate and BP of the patient. Now we'll see how alpha 2 receptor act on pancreas. So we all know that it's a stop receptor or break receptor. So when it act on beta cells of pancreas, when alpha 2 receptor of pancreas get activated, it will decrease its secretions. We all know that beta cells secrete insulin, so insulin will decrease. And what happen, if insulin will decrease, then the blood glucose level will increase in our body. So during stressful conditions, our muscles and brain need more glucose. So in those conditions, what happen, the sympathetic nerve get activated, and at that time the norepinephrine, okay, the norepinephrine will tell beta cells, please don't release insulin. Okay, so that there will be more glucose in our body, and the insulin so the insulin will stop temporarily, and the glucose that is accumulated in our body will be used by our brain or muscles. Now we'll see that how these alpha 2 receptors act on our salivary gland. Okay, so suppose in salivary gland, when alpha 2 get activated. Okay, so we all know that alpha 2 receptors are actually stop or break receptors. So when alpha 2 get activated, then salivary glands will produce less saliva. Okay, so there will be less salivary productions in the patient. Okay, so that's why any patient who take alpha 2 agonist, like any like clonidine or methyl dopa, okay, so any alpha 2 agonist drug, then they complain of that I'm having dry mouth. Okay, so in the same condition, like when there is sympathetic activations, the person will have dry mouth. Okay, so why? Because alpha 2 get activated and they will produce less saliva. Now let's see how alpha 2 acts on platelets. Okay, so when alpha 2 get activated on platelets, okay, the platelet become more sticker. Okay, and when it become more sticker, then it will start aggregating with each other, and it will form a bigger aggregations, and it will help to reduce bleeding during injury. Okay, that's why whenever there will be cut or anything or any injury in our body, then at that time sympathetic activations will be occur, and that sympathetic activation will what it will do, it will cause alpha 2 activations and platelet aggregations, so that the bleeding will stop. Now we'll see the alpha 2 receptor effect on fat cells. Okay, so the alpha 2 receptors of fat cells will decrease its breakdown. Okay, so we can also say that in fat cells it will decrease the lipolysis. Now in the first paper we have seen that how alpha 1 receptor act on eye. Okay, that how it causes mydriasis. Now we'll see here how alpha 2 receptor act on eye. Okay, so suppose this is our eye. Okay, suppose this is I don't think it's a good diagram. Okay, but let's see. Suppose this is our lens. Okay, and this is ciliary body and this is iris. Okay, so actually when alpha 2 receptor get activated on ciliary body, then it will decrease the aqueous humor productions. Okay, so actually when alpha 2 receptor of ciliary epithelium activated, it will decrease the aqueous productions, and when aqueous productions will decrease, then it will decrease the IOP, that is our intraocular pressure. So in clinical use, if we'll talk, when we used to give brimonidine, okay, it's an alpha 2 agonist drug in open angle glaucoma, because in open angle glaucoma we all know there is partial obstructions of the pathway, and there is, so that when aqueous humor productions will decrease, then that will decrease the IOP, and it will helps to reduce the symptoms of the patient. Okay, so this is all about alpha 1 alpha 2 receptors, how alpha 1 receptors act on blood vessels, intestinal sphincter, urinary bladder. In the same way we saw that how alpha 2 receptors, these stop or break receptors, act on presynaptic nerve terminal, how it helps to decrease hypertension in pregnancy, how it work in brain, how it work in pancreas, salivary gland, platelets, fat cells, and eye. Okay, so this is all about alpha 1 and alpha 2 receptor and how these receptors are distributed in different parts of our body. In the next video we'll talk about beta 1, beta 2, and beta 3 receptors. So if you like this video, please share with your fellow medicals, and please subscribe my YouTube channel and follow my Instagram, YouTube page. Thank you.